If a healthcare worker is watching this and wondering, what difference is this going to make for me day to day in my job? What difference is Santé Quebec going to make? How would you explain that to them?
We would like them to be proud to work. I know it's difficult. We went through 3 years of pandemic. And I think that if we are able to give them good conditions, so instead of going to private or to agencies, they are able to say, oh, I can see the changes. Give us the confidence that we are working this turnaround that we do right now. And I think that they will be very proud to be part of the changes that we make.
Christian Dubé in the question and answer session. That's our own Matt Grillo from CTV asking the question. This all in, of course, reaction to what's being called Bill 15 for the time being, aimed at making the health and social services system here more effective through the creation of something called Santé Quebec. Now, I realize it's early, but already, I don't know if you read Tom LaCare's piece in today's Gazette, there's some criticism to be thrown around here because obviously the problem we've talked about for so long has been the fact that we're ignoring the people who work on the ground, in the system, and creating basically more bureaucracy. Is this any different? Christopher SKEETE is the M&A for Sainte-Rose. He is also, of course, the minister responsible for the fight against racism. Chris, thanks for taking the time this afternoon. We appreciate it.
Very happy to be here, Aaron.
Let's talk about that question, first of all, as far as people on the ground. You heard the question and you heard the answer from Monsieur Dubé. How does Santé Quebec address that?
Well, what we're doing here, and let's just recap for your listeners. We're talking about 1,300 paragraphs, one of the largest in the history of the National Assembly that will create Santé Quebec, as you said. We're going to separate operations from the strategic vision. In other words, separate the operations of healthcare management from the day-to-day of politics of healthcare, okay? And then we believe that that will create a healthcare system that's going to be more responsive and it's going to be something that people will have within the network. For instance, we believe that the status quo is no longer acceptable. The pandemic taught us that people are fed up, unfed up, and that they want something that's going to be more responsive. Santé Quebec will have one mission: delivering quality health care to Quebecers. That's it. And if you're looking for something that we use sort of to motivate ourselves in this view, think of the vaccine campaign. That's what we think efficient, optimized healthcare for Quebecers could look like, and that's what we're trying to create here.
I'm thinking about the fact that, there's 300 pages in this bill. I'm thinking about the fact that there's a new entity being created and how the transition could potentially be a bumpy road. You talk about people being fed up, workers are fed up, people are fed up not being able to find a family doctor or get access to the services they need. This is supposed to be all about accessibility, Chris, and yet I worry we're in for a bit more of a bumpy ride in trying to make things easier.
Well, again, and I appreciate the question, and we're not at our first reform, right? The government of Quebec has tried this before with other governments, and I get that people are suspicious of this one. I understand that. But again, I think we all agree that the status quo was not acceptable, and if we're looking for a change, this is the kind of change that we need to have. For instance, when we create Santé Quebec, we're going to have what Minister Dubé calls Top Gun. Managerial experts, operational experts that are going to be in charge of making sure that there's accountability in the system, that the people who are there to deliver the services deliver them. Let me give you an example. Right now at the Ministry of Health, there isn't even a person whose job it is to overview or to oversee all of the HR throughout the network because there's 34 different employers spread out over the territory that sometimes work well together, sometimes don't. Now we're going to have one entity, one employer. We're going to go from 136 collective agreements to 4 collective agreements, and we're going to be able to optimize our services and our resources. So a nurse who's working in Laval, in my riding at Cité de la Santé, is going to be able to say, well, you know what, for all kinds of reasons, I want to go work at the Jewish. She won't lose her seniority. She'll be able to keep her seniority, and she won't be bound to a place where right now she has to be bound. Another novelty of this bill is creating management at the local level. So we believe that when the management is at the local level, you have more decentralized, more ground-based decisions being made. Now, this is radically different from previous reforms where the focus was on saving money. This is not about saving money. This is about creating a human system, and it's about creating an efficient system.
Chris, how many healthcare workers are being hired via this bill?
Well, this isn't a hiring bill. This is a structure that we're going to say gives us the chance to succeed. And it creates an environment where nurses and doctors are going to be more effective. Let me give you an example. Right now, we're studying a bill to eliminate private nursing agencies from having the best dibs on the scheduling, right? So we're doing that at the same time that we're presenting this bill. We believe that if we create better scheduling, it's going to create a more attractive environment for nurses to come and work with us. At the same time, if we have common collective agreements, we'll have the ability to have the same rules for everybody. So a nurse, again, who wants to go work in another department, she can go do it, and she can move up and down as she sees fit, creating a sense of belonging. Little things like that are right now irritants in the network that prevent us from having the best outcome.
Okay.
And we're going to be fixing those things directly.
I understand those are irritants. I think maybe a bigger issue, and people might agree, is what are you doing about things that people complain about who work in the field, like, for example, mandatory overtime? I've heard nothing about that. How's that going to change?
Mandatory overtime is a function of reduced labor force, which is a function of the fact that it's not fun to work in a hospital right now. So it's kind of like the chicken and the egg, Aaron, and I think your question is dead on. You cannot look at forced overtime without looking at the same time at the conditions in which we have our nurses working. If a nurse is working in an environment that she's not happy in, that she's overworked, overtaxed, in an environment where there's not enough people there to help her and support her, where she doesn't get the tasks delegated to her by doctors, this creates an environment where it's not fun to be a nurse, where it's not professionally stimulating to be a nurse, and there's no sense of belonging. If you can fix the operational side by making sure that people are being used to the best of their ability, we're making the bet that's going to be easier to recruit. But you're right. There's 7,000 nurses missing right now. This is always going to be an issue for us, but we're working on that as well. As I said before, we're working on the nursing agencies, and we're trying to get some of those nurses back into our system to help us out.
Okay, there's 7,000 nurses missing, right? But, it's all well and good to suggest that this change will make a difference. We've talked to people in the nurses union, nurses, of course, as well, suggesting, it'd be more fun, as you say, to go to work if I could get paid what I should get paid. So I'm going to ask the question again. If we have to hire nurses because there's a shortage in the system, why isn't there a plan to pay them more?
Well, just to recap, when we had the pandemic, we created new incentives for the nurses to be able to work. And we created new incentives that were money-based, financially based. You know that the union, they took us to court because they didn't like the fact that we gave them extra money without speaking to them first, but we thought it was a no-brainer. So we actually are the first government in the history of Quebec to have had in the last collective agreement round a négociation différenciée. What that means is we said the nurses are going to get more money because nurses and also teachers deserve more than everybody else. And we didn't give them the same 2% rate that everybody else got. So we were the first people to pioneer that because we believe that it's time to pay our nurses more. So we've already done that. And we're already trying to do that again in this collective agreement. So that kind of out-of-the-box thinking is not new to us. We're continuing it in this collective agreement round.
So I'm looking at this in terms of how many nurses have already left to go work in the private sector. And we know that things in general are working much more smoothly in the private sector. And I understand that Santé Quebec is going to help organize elements of the private sector. But I think what I want to know here is, will the public sector start to function more like the private sector under Santé Quebec?
That's a good question. I think we have to separate our initiative to create the two test pilot projects for the private hospitals, the one that we announced during the campaign. That's separate from what we're doing here today with Santé Quebec. What we're saying is if it's going to be a private hospital, it's going to be like a mini hospital, it's going to be publicly funded, right? When we say private, we're not saying that people pay out of pocket. It's going to be the healthcare card that you go to. And we believe that by creating that kind of healthy competition, it's going to serve as a benchmark for the rest of the managers that are going to be in Santé Quebec. So we're doing the mini hospitals. There's 2 right now in the pilot project that we're working on building. That's very different from what we're doing with Santé Quebec, and it's unrelated. And also, just not to scare your listeners, when we say private, we're not talking about you pay money. We're saying offered by a private service, but paid for by your SUN card.
Right. Chris, we're going to run out of time. I want you to hear what Andre Fortin, so he's obviously the health critic for the Liberals, had to say about this. Take a listen.
There seems to be a major focus here on the structure of the healthcare network instead of a focus on patient care, on attracting people to the healthcare network, on making sure we have the proper resources to treat Quebecers when they need care.
It seems to me that's a valid point. If I go back to what you said before, and I don't want to sort of play this, but the idea that, you talk about, we paid the nurses more, we gave them bonuses, yet they take you to court. We talked to the head of the nurses union saying, he doesn't understand why the government won't even sit down at the negotiation table now and try to work out a better pay scale. So what's going on here? Is this more of let's centralize because we used to decentralize and hope this works for the best?
So there's a lot to unwrap there. I know that you're pressed for time. I think my colleague there is forgetting to mention numerous things. One of the things is the recent agreement we made with GP to get 500,000 more Quebecers followed by a medical practitioner. That's something that was a quick win in Mr. Dubé's plan that we already did. He's also discounting the efforts that we did in order to abolish the private nursing agencies and the monopoly that they had on quality scheduling. And this still comes in support of that whole entire system. And also, I don't think he's recognizing the important strides we took in making sure that nurses get paid more. So it would be ill-advised for you to see this initiative outside of the whole initiative. Ever since the pandemic, we've been working to re-qualify or recreate an environment where people have a more humane and a more efficient network. And like I said, we had some successes. If you look at the vaccine campaign, that's kind of where we want to go.
Yeah, but I think we have to agree. We're never going to have a more efficient network if we don't have the workers, if we can't keep them happy and keep them on the job.
And pay them what they're worth.
So that's what it's going to take.
So we believe, but you guys keep coming back to money. I have to say, we already gave them significant increases, and we're currently negotiating with them now. And we've already said that we want to give them more. So money, we get that. We know that we have to attract nurses. But I think the working conditions, if you ask any of the nurses, my wife included, the number one thing that they'll say is it has absolutely nothing to do with the salary. It has everything to do with the quality of life. Okay. Every single nurse that I know has become a nurse not for the money because they want to help people. We need to give them an environment that allows them to do just that. That's what this is about.
Chris, fair enough. I appreciate the time as always. We'll see where this goes.
Thanks a lot,
Thank
guys.
you. Christopher SKEETE, M&A for Sainte-Rose Laval.
No mandatory overtime.
I know. I was going to say we're out of time. It's one thing to say you're going to pay them more. It's another to do. Actually,
and it's not obviously it's not just the money. It's a combination of things. But I'd say mandatory overtime is
pretty big one
out the window.